is going to work for us. Hi, everyone. This is Natasha. I am the founder of Chai for Charity, and welcome to the second in our series of virtual chais. We are so happy to see you. I'm going to start by introducing Amanda, who is your host for this evening, and will tell us about herself and how she chose Chai for Charity and how she chose today's nonprofit to highlight. Amanda.
Great. Hello, everyone. Happy Friday. I'm so excited to see you all here. For those of you who don't know me, I'm Amanda West, and my pronouns are he, she, and hers. And I'm so excited to kind of continue building community here in Boulder. We moved here 2 years ago, and while I do work at Google, the reason we came here is to be part of this community and live here. And it was hard to leave my community in Berkeley. And so what's really made me feel at home here is getting involved in the organizations that you're getting to know over this series of happy hours. So my passions are social justice and feminism and all of that. And so you've seen that through these happy hours. What's top of mind right now for me, though, as you can see from my sweatshirt, is the lack of justice that we saw this week for Breonna Taylor. And so that's one of the reasons why I decided to break out the Outward Brewing Company beer, because it's a Black-owned brewery here in Longmont. And that's top of mind for me as well. So Karen and Jamie, look out, I might be asking some questions about how we're supporting Black and Brown folks in reproductive rights as well, and involving them in this. But one of the ways that I really got involved in the community here is I went to the Racial Equity Summit for the Boulder Valley School District. And there I met Allison Billings, who we heard from last time. And I also met Katie Borden, and Katie introduced me to Cobalt. And Katie is on the board of Cobalt and has generously offered to match donations today up to $500. So thank you, Katie. I hope that that and Karen and Jamie's conversation will inspire you to give even more. Reproductive choice is really important to me, and it's been important to my family. And I'm happy to talk with that in like smaller one-on-one conversations. But it's people then folks feel comfortable talking about, and I want to support this. And with RBG's passing and the Supreme Court seat opening up and the Senate moving forward, this conversation is even more important than ever. So that is why I want to hear more from Karen and Jamie about Cobalt, and look forward to having a conversation with you all about it. So I will hand it over to Karen. Oh, and I didn't actually, sorry, before I do that, I didn't talk about Chai. So one of the reasons, that we're all here is because of Natasha and Lauren John from Chai. And Natasha welcomed me to Boulder as I was just moving here. And she also shared Chai and the experience. So in the before times, Chai used to have in-person events where they would bring in 3 nonprofits and people would get to know them all at once. And I was going to host one of those in June, so I was going to invite y'all then, but it got postponed. And so I urged them to try to consider this online and hope that it continues to be something for Chai. They even had one for kids and getting kids involved. So it's just an amazing way to support local nonprofits. And I'm really appreciative to Natasha and Laura, who is just amazing putting together all these goodie bags for everyone, and John helping us get all up to speed on Zoom. And so thank you all. And now I'll really hand it over to Karen.
Thank you, everyone. Can you hear me okay? Great. I'm Karen Middleton. I'm the president of Cobalt, and I'm really excited to have this opportunity. And what a concept! I mean, I just got to learn more about Chai for Charity yesterday with Natasha. I heard about it, but really got to hear it directly from her. And so I'm just really excited to be here. Thank you to Amanda. Thank you to Katie. And you've heard that Jamie's joining me. So what I'm going to do now is go ahead and share my screen. And I'm going to share, I have a short presentation, and then I have a short video. So I'm going to pop it over here. We're going to go here, go view. All right. Can everyone see that? Great. Okay. So Cobalt, we're about advancing abortion access and reproductive rights. We feel that everyone is stronger when everyone has access to reproductive health care. As Amanda just mentioned, you know, with RBG and in this moment where racial justice, economic justice, all of these issues are, we're in such a raw time with all of these issues that some of the language we use was really we didn't know we would be as ready for this moment as we are. So I share that it is a time that we're grieving and also figuring out how to fight. So Cobalt believes that nothing should stand between you and your health decisions. And the reality is that these assaults on reproductive health care and autonomy are intensifying across the nation. And this is on top of barriers to reproductive health care that so many already face. And sometimes as you don't always see that these are there, but actually in the current times that we're in, we have seen lots and lots of policy changes, whether it's an employer changing access to reproductive health care, or an insurance company changing a benefit, or a state or government policy limiting access to care. We are seeing continued constraints on this. And your reproductive autonomy should not be dependent on your job, where you live, your financial situation, or frankly, someone else's political agenda. We believe that it's time for every Coloradan to make the healthcare decisions that are right for them, free from stigma, systemic barriers, and politics. And this is my statewide engagement coordinator, Justine Sandoval, and she took this picture when we sent a couple of our staff members out in March to watch the to be outside for the oral arguments for the Supreme Court. And the case was June Medical Services. June Medical Services was attempting to basically ban access to abortion care in the state of Louisiana. And it was based on a case that had happened in Whole Women's Health in 2016 in Texas. So you might remember that clinics were shut down in Texas and that they came up with these TRAP laws, targeted regulation of abortion providers. And so it was really important for us to be there. And that case came out favorably. There was no negative change, but the only reason that Justice Roberts sided with the majority opinion and allowed that Whole Women's Health case to stand and allowed those clinics to remain open was because he did not want to reverse a recent precedent. I'm pointing this out because Justine today just got back from the Supreme Court and the Capitol, where she was able to honor RBG. So she's a young activist who's been involved with our organization for 5 years, and one of her friends called her on Monday and said, "I'm flying you out so that you could be there." So we feel this work really directly, and the threads between what's happening at the Supreme Court and what we're doing in our own backyards are really connected, and that's something that Cobalt tries to do. So I thought that was a good illustration of the work we do and why we do it. And then, so what sets us apart? Look, lots of groups focus on healthcare or women's healthcare. We actually center abortion access in our work. Other healthcare advocacy organizations don't do that. There are organizations that will work on birth control, they'll work on all sorts of things. And we really carved out that space where this was what we were going to protect, because everything that is tied to whether you can make that decision about your reproductive health care really is related to everything else, right? Whether the Supreme Court is restricting access to birth control, as they did in a recent case with the Sisters of Loretto. It was a very dangerous case that says that employers can decide if you get access to birth control through their program or not. And in 2020, I don't think our employers should have that kind of access. And that's the kind of, it was actually Little Sisters of the Poor, sorry, but nevertheless, the idea that the Supreme Court is restricting access right now, it's all a related conversation. So this is something that we really take head on, and it really is where we center our work. So we do work on challenging opponents and structural barriers. We are sort of the out loud and proud. We will show up and raise our voices and raise our signs. We will also advocate directly. We work with elected officials, policymakers, think tanks, and organizations. And so we really try to encourage them to move on their policies and really be more inclusive in thinking about what is important and why we think it needs to change. So here's what we do, kind of our daily work. What we do year round is that we support and elect lawmakers who will actively fight for reproductive freedom and hold them accountable. And we do that both in political work and then in civic education and outreach work. So we might be talking to individuals about the kinds of policy ideas that they may see coming up at the state capitol or coming up at the federal government and encourage them to learn more. We might do a take action, so an action alert when a policy is being moved, such as whether we're working on replacing a Supreme Court justice just days before the election. We think that matters. So we will speak out, and we will do it in a range of ways. We fund and establish support structures to ensure that everyone has access to care. So we do run an abortion fund, and I'll tell you a little bit more about that. And then we work to reshape the conversation around abortion to fight stigma and misinformation. So we do grassroots organizing and lobbying and civic engagement. Now, our abortion fund, we didn't start it, but we have picked up that work and continue it. It was established in 1984. So one of the unique things about the state of Colorado is that we were one of the first states to decriminalize abortion in 1967. And we are a direct democracy state. So there are lots of ballot measures that you see come out here, and a ballot measure that unfortunately passed back in 1984 took away any public funding for access to abortion care. So that means the people least able. So people of color, poor people, folks who need a hand up are the very people that are not able to access care. And just imagine for a moment, if you're making a decision about whether you are expanding your family, the number of seats in the car, the jobs, the daycare, everything that's involved. The idea that we take that away from someone who'd be accessing state funding for their basic needs, it's a shameful piece of our history. And the Cobalt Abortion Fund was established by the First Universalist Church in order to respond to that. And so this faith community came together, and they were a scrappy little grassroots group. So from 1984 until 2017, it was volunteer run. When we worked with them and partnered with them, there were only, they were raising and spending $60,000 a year to help provide direct support for people in need. And it was one volunteer for the last 8 years who was responding to every single email that came into that group. And when I first met them, they were in their 70s at the time, the set of women who were kind of the core group. I really thought that if we teamed up, we could expand that and do more. So we, not only is it 100% donor funded and the only independent fund, when we expanded it, we took it over in December of 2017, we have expanded our outreach exponentially. So we grew that fund. So this year we're raising and spending approximately $260,000 that is going for direct support. So if someone comes to Colorado or they're in Colorado, they are seeking access to an abortion and they cannot afford it, this is a no questions asked fund. We have pre-existing relationships with all the clinics in the state. And it doesn't matter if you're traveling from Texas, where COVID shut down access, or you are going from Boulder to right down the street, that you can now get that access if you need help, and we will provide that help. We've even expanded it, and we'll talk about this a little bit in the some of the resources that are available to our folks the clients who we serve, is we actually run support a food pantry. So there are pantry items at the clinics if someone is coming here from another state. We also do grocery delivery. We have been in Boulder actually taking food to people who are in hotels. We had a woman drive with her children, had to stay for a few days for the Boulder Abortion Clinic, and we were making sure that they had groceries served. And we staff all of it using our own social worker. Amanda Carlson's the director of our fund, and she is a social work intern. And so we are paying staff and compensating them for providing the service. So it's an important piece of our work. and something we're quite proud of. And when you think about it, some people are interested in that direct support. How can I help right now in this moment? Other people are interested in the policy or the politics, and we provide an avenue for everyone who wants to get involved in this conversation and really meet them where they are. Now, I want to share just a snippet of what's going on with the ballot measure that's happening here, because Colorado is a centerpiece. We are the place that the anti-choice movement likes to come and test ballot measures and then expand their work to other states. So if I will give you a few slides and just share this, and then I'll turn it back to questions after we show our video. But I did think it was important to just share sort of the scope and scale of what this, what the folks who are our opponents in this are trying to do in shutting down access to care at a moment where we might lose Roe v. Wade in the courts. So I will, let me just share a little bit about what's going on here. So we have a campaign where Cobalt is one of 7 organizations that is working to oppose this ban. And it is a ban that would cut off access to abortion after 22 weeks. And this is a 4th time we've seen something in Colorado. They've repeatedly rejected bans here in Colorado. Colorado, if you're new to Colorado in particular, to know or don't live here but know about us, this idea of abortion access is a fundamental kind of a Western value. Government out of my business. You know, we don't have a helmet law either, if you think about it. There's that Western underpinning where less government is more around certain issues, and that has been consistent with this. So when they voted to decriminalize abortion here in Colorado in 1967, it was signed into law by a governor who was a Republican, and it was run by a Republican and a Democrat. And so where this issue has gone, and it's top of mind in lots of the political conversations, and where it started here in Colorado is really a sea change, and we think it's important to share that. We believe that health and not politics should drive important medical decisions, and I just want to point out that what they're trying to do is pass a ban. They've set an arbitrary limit, but we know that every pregnancy is unique. We know that it would force a woman to carry a pregnancy to term with no exceptions, and that it's intentionally confusing. So what they try to do is they tweak and poll and measure, and they're trying to essentially sneak this through. And I will tell you what they've already said to us is they won't stop there. So I did want to give you a couple of snippets around this. This is what we believe, and we think this actually is something that is not just the case in Colorado, but all across the country. But I'll tell you in Colorado, this is particularly true. And I also want you to know that in head-to-head polling right now, if you just ask people about this ballot measure with no context, their inclination by a tiny margin of advantage is to pass it. And so we're working to defeat that. We're gonna skip some of this, and I'm going to move right now to the, I'm not going to stop share, but let me exit. I'm going to move to the video now, but I just want to give you a little bit, and I'm happy to tell you more about the ballot measure if you're interested, but I want to just give you a flavor of, and why does Cobalt lead on this work? If you think about what I was sharing in terms of our core mission and values, the idea that we are in a leadership role in trying to defeat this measure, and at the same time, we are trying to educate people about abortion later in pregnancy so that we're not faced with the level of information that we need to provide to people so that they better understand the issue at hand. Now, one way we do this is I'm going to share a story of the Taylors, and I just need to make sure that you can hear the audio. Let me just, I think if I disable, look, I'm going to try it. If you can't hear it, I'm going to stop it. Can you hear it? Oh.
No, we can't hear it.
Okay, hold on. I understand there's a setting so that you can hear it in the screen. Hang on one second.
John, jump in here if you know the answer.
Yeah, Karen, if you don't see the setting, I know with the share screen function, when you press share screen originally, there should be a lower left-hand box that says share my computer audio. But in order to click that, you'd have to stop sharing and reshare. So
Okay.
I don't know if that would work if your other way doesn't work.
Hang on one second. Start screen. Share computer sound.
Yeah, that should work then.
We're nimble here. Let's see. Okay.
Ember, are you giving us some advice too? I could hear you talk. I see
Yes,
you
Taylor?
Roy Mitchell Taylor.
You hear it?
We've been
Roy.
together for what, 10 years now?
Yeah. I'm from Texas originally.
Yeah, I grew up in Texas as well. We got married and then had our daughter. We had another son a couple years after that.
When my daughter was about 9 months, Texas passed the 20-week abortion ban. And I felt unsafe to be pregnant there anymore. I wanted more kids. And so it was kind of one of the catalysts for us moving to Colorado, someplace where I would feel as if I can be pregnant and I can feel safe to make my own decisions. We had an opportunity for Roy to look for work in Colorado, and we made the move. Then I was pregnant again for a third time, and we were very excited. We showed up for the ultrasound, and we found out that something was very wrong. The doctor came in and told me, okay, so you have no amniotic fluid. It was blatantly obvious that he didn't have any kidneys. And we decided to, get an MRI, confirm the diagnosis, which we did. And they told us not only did he not have kidneys, he didn't have a bladder either.
A birth defect that is incompatible with life.
Yes, and that was what we were told. It was either terminate, at my discretion, or just wait for my baby to die inside me. And it was like, I had 2 small kids at the time. It was really hard. So I cannot imagine being in an emotional state that I would have been for months on end. And just waiting. So I did what was best for us and our kids. I decided to have an abortion.
This proposition is similar to what they were trying to do during the legislative session, which is add more roadblocks to free and clear abortion.
This proposition makes no exemptions for rape, incest, health of the mother, or fetal diagnosis like ours. Our diagnosis was pretty straightforward. It was basic anatomy. He could not live, right? And so there are other women who I have met who have had diagnosis where there's perhaps be a tiny little chance of viability, where it's like, okay, well, if you wait a few more weeks, the baby will develop more and we can have another ultrasound. We could see a little bit better this time. But if there's a ban in place at 22 weeks and you get a maybe, then you can't wait. And so people who would be inclined to perhaps wait and see if they could progress in their pregnancy would be otherwise inclined to just be quick and just go through with a termination before 22 weeks. It definitely forces a decision, which is just unfair.
Well, these questions on weeks and when they start, they're built on this assumption that every woman's cycle is exactly the same. And everybody develops at this same rate. And the notion that at this week cutoff period, this means that, it's not the case.
Because every situation is different, you can't do that one size fits all. I know that it was a decision that I made that was the absolute best for my family and absolute best for me. And so to think that there are people out there that want to take away my ability to make that decision, think there are people out there that want to make me feel shame as if I did something wrong, it kills me. No Coloradan should have to leave the state to access abortion care. And that's why people need to vote no on Proposition 115. I know for a fact that if we had stayed in Texas and I had gotten this diagnosis because of the 20-week ban they have there, I would have had to leave the state. And I know that that experience, on top of the trauma of losing a child to begin with that you wanted, would have made it so that I probably wouldn't have wanted to be pregnant again, or at least for a very long time. I mean, that is real trauma right there. I know how much I hurt in the best of circumstances, and I can only imagine what it would feel like to have barriers in the way and still feel this hurt underneath it all. We're proud to be part of an organization like Cobalt because we agree that nothing should stand between someone and their healthcare decisions.
Cobalt is busy every day building a world where everyone's health decisions are free from stigma, politics, and barriers.
If one person's freedom over their own body is threatened, that impacts us all.
It is so important that we come together to protect access to care right now with abortion under attack in Colorado.
Join us and give powerfully in support of Cobalt in the most important election year of our lifetimes. Thank you.
Thank you.
Right. Okay, that is, whew, goosebumps. But I am happy to take questions, and if I missed anything, Natasha, Amanda, Katie, Jamie, jump in.
We probably have time for 2 questions
Okay.
because I want to make sure that there's time for breakouts, and I'm going to tell you a little bit about chai, and then if folks have additional questions, we'll be on for another 30 minutes from 5 to 5:30 for mingling, and Karen and Jamie will be here to answer your questions then as well.
And I'm happy to defer till later. That's totally fine. I just want to thank you so much.
Of course. Does anyone have a burning question? Because I'm going to talk about chai, and then I'm going to have us go into breakout room so that we can talk more.
I think there were some questions in the chat.
Thanks, Katie.
Mm-hmm.
I'll ask my question that was in the chat, Karen, because of this week. As I was looking for kind of the connection between women of color and abortion rights, I found this New York Times article that I hadn't seen before. I'm sure you've seen it, that you can see in the chat. I can't focus on abortion access if my people are dying. And I'd love to hear like how you're addressing that in Colorado, at least, especially with what you're doing around 115.
Really through all our work, and we do work in coalition, but we try to work very intentionally to lean into anti-racism work, both in how our organization operates, who becomes part of the organization, who we're serving. But beyond that, let's be fundamentally clear. The people most impacted by any ban are the people least able to afford it. And COVID really highlights that, right? So who could not get access to healthcare? Who could not leave their place of work? Disproportionately impacting and killing people of color in the time of COVID. The same people who can't get in to see the doctor quickly may not have immigration status that allows them to access care. If they're going to a federally funded clinic, there is a domestic gag rule that prevents you. So Denver Health is the public hospital here in the Metro Denver area. So it'd be like your public or county hospital. If you walked in there and you were getting health care and using Title $10, they are not allowed to talk about whether you can access abortion. If you are raped in Pueblo, 100 miles south, and you are taken by ambulance or a victim of sexual assault, you're taken by ambulance to the Catholic hospital or you're taken by ambulance to the community hospital, whether you know that Plan B is an option for you, whether you would be counseled on being able to access an abortion in case of rape, isn't allowed in certain hospitals. So we feel very much that this work disproportionately impacts communities of color, and it's systemic racism, it is discrimination on every level, and it's also the way we think about it and look at the racial justice and economic justice issues around women being forcibly having forced hysterectomies. It's the same lack of self-determination. And you heard from the Taylors talking about being able to talk about their options. Some people aren't given those options when they talk to a healthcare professional, and we think that's wrong. And so we really try to make sure that we lean into that work. But we also work in collaboration with other organizations. Calor serves predominantly a Latinx community, and we are working really hard to make sure that we are in partnership or allyship with organizations that are led by people of color, serving communities of color, so that they know what that impact is and that they're hearing authentic voices and not necessarily my voice about the importance of this. So hopefully that answers your question, but it's very much top of mind for us.
That's helpful, thanks.
I don't have a question, but I just wanted to thank you, Karen, for the presentation, and I'm really happy to support the cause. It was really powerful stuff that you shared.
Thank you very much.
Karen, you might have said this in the beginning, but how again did you get involved at Cobalt?
You know, I didn't say that. I often, when I'm talking to a group in a room, when we could all do that, I would always say, if you ever asked me if I would be doing this work in this moment in my life, I never would have believed it, because at this stage of my career, I never thought we would be where we are. So I was an elected official. I was on the State Board of Education, and then I was a state legislator. And at the time, I was in the state of Colorado in the House. I was there through the 08, 9, and 10 sessions. Had a baby while I was in office, actually. So I was living a pretty complicated life. We probably saw one anti-abortion bill a year, maybe. I left and went to run Emerge America in San Francisco. So I was living in the Bay Area for a couple of years, and I came back with that job and really was traveling too much. I had a 4-year-old. I had a 50% travel job. You can all relate. So I heard about this job, and I should also say that this was previously a NARAL Pro-Choice Colorado entity. It was an affiliate of NARAL. I didn't say that, but we became Cobalt earlier this year. And when I stepped into this role, we started seeing in 2014 6, 8, 10 anti-choice bills. And it's a little bit like if you followed the voting rights legislation in 2011, there was an explosion of all the state legislatures running bills. We saw that around abortion bills, anti-abortion bills, restrictions, starting in about 2011. So it was a dramatic change. And for me, it just felt like it was the moment I arrived. I've got stepdaughters in their 20s. I've got a daughter who is 12. I stood there in tears when Brett Kavanaugh was sworn in as the next Supreme Court justice, and he and Justice Gorsuch, given their age, will affect my daughter's entire reproductive life, and that is wrong. So I saw it from a policy and from an organization leadership standpoint, and I have been running Cobalt now for 7 years, and it feels like it's more important, more dangerous, and more scary every year. I'll tell you, our pinnacle is that this ballot measure, someone asked about it, I'm co-chairing the fundraising committee. It's an $8 million campaign. When we first heard those numbers, and we were told, and especially if you've got experience at Google or in tech, running a $5 million media campaign in this environment where everyone is home, it doesn't sound as crazy as it might in other years. We just surpassed $7.5 million in fundraising for this yesterday, and no one thought we could do it. And we're going up to 8.3 in order to defeat this. But that's the level of passion that I bring to this. Is I leaned in with 6 other organizations, and we just went for it in a moment where there are so many fights. So that's a long answer, but sorry, but I bring a lot of heart and a lot of my own personal story to it, and I kind of fell into it, and it was the moment to turn around and make a go of this, and we're really in this for the long haul. So we've substantially grown the organization. I had 3 staff when I started. We just this week hired our 11th full-time employee, and we hired in the middle of COVID. We did not cut anyone's positions, did not cut salaries. We made a commitment to keep everyone on board through that first rickety moment. And we are in fact growing right now to fight for reproductive rights. And I do have my RBG tribute candle. I did wine, and we cut these out. Bought the little candle at Safeway. So if anyone's looking for a meaning moment this weekend, I had so much fun doing this. but I'm in it, and I'm staying for a while. Like, I am here. I think the fight is here, and I'm holding steady to try to get this ship through really rough waters. So that's enough. Oh my gosh, I do know John Myers, Beth Myers.
It is so hard to follow that. My whole heart is with you. Thank you so much.
Thank you.
Of course.
I'll hush now.
You're fine.
I want to hear what you're up to.
Good news. We are going to do breakout soon, and someone from Cobalt will be in every breakout. So you get to ask all your questions then too. Thank you so much, Karen and Jamie. So I will tell you a little bit about Chai for Charity, but I will make it quick because many of you know us, and you can search for us online and get the rest. My name's Natasha. I am the founder of Chai for Charity, and we're a small organization run with a couple of volunteers who are also on the call, and I wanted to call them out. So 3 of us run Chai for Charity. It's me, John, who's strategy and operations, give us a wave, there we go, and IT for our team, and Laura Stewart, who runs all of our community engagement and works with our nonprofits and our business sponsors and our guests. So we are a mighty small team. A little bit about Chai for Charity. It was invented 9 years ago when I done all this research about nonprofits that I wanted to invest in and wanted to share that information with my friends. So we ran our first Chai in 6 locations across North America. We raised $6,000 for survivors of domestic violence. It was electric. I was excited. 2 weeks later, I was pregnant with my first son, and I've been pregnant for 8 years. I've got 3 kids under 8. And a couple of years ago, I decided to relaunch Chai for Charity in Lafayette, Colorado, in my backyard. And it still had the power that I thought that it had all those years ago. And we became established early last year. So we are a very new nonprofit. Our mission is to inspire people to give in creative ways. So what we do is we work with hosts like Amanda who identify causes that are important to them, and then we find small local nonprofits that we can pour our resources into. So we've got 3 goals: connection, awareness, and expanding the way that we think about giving to be more inclusive. So connection is gathering our friends and family to tell them about the causes that matter to us. Awareness is drawing awareness to small local efforts that could really use our support and you might not otherwise be aware of are in your backyard working with our community. And 3, expanding the way that we think about giving to be more inclusive of folks of different socioeconomic backgrounds and generations, because each of us at different parts of our lives and in different phases of our life, but universe has different things to give. So 20-year-old me had lots of time, but no talent or money. 40-year-old me has no time, but some talent and money. 60-year-old me will have a whole different set of resources to give. So that's why Chai for Charity exists in its current model. And what else can I tell you? Oh, my pronouns. I meant to start with that. My pronouns are she and hers. And I wanted to end with our wish list wall. So if you were here last week, you've already seen our published wish list. You also got it in an email. We use the wish list to source goods, time, and talent from our nonprofits, and we invite you to commit to giving in those categories: goods, time, and talent. I can tell you more about that by email, but I don't want to take up any more of your time. Thank you so much for being here, and I look forward to hearing from you after you get to connect with some of the folks on this call. Thank you. Stay tuned. So I want to respect everyone's time. Wonderful. Welcome back, everyone. Welcome back. I realized that wasn't a ton of time to make deep connections in your breakout rooms, but hopefully it was enough to get a conversation started and for you to get some of your questions answered by the amazing people from Cobalt. To honor your time, we are going to close right now, but we invite you to spend an additional 30 minutes mingling with us. We can pause, you can have a bio break and get another drink of your choice and join us for some mingling. Thank you so much for joining us. Amanda, is there anything that you want to say as we close?
I just want to thank you all for being here. I'm really touched that you're all here and supporting Cobalt and supporting Chai. And I really enjoyed our breakout conversation. So I hope you all had a great conversation too. And see you hopefully in 2 weeks in our next Chai series focusing on Defy Colorado.
Yay. Thank you so much. Feel free to drop off and to stay. The Cobalt team and the Chai team and Amanda will be staying.
Awesome.
Bye. Thank you.
Thanks for joining.
Thanks. I love that you said, or go get another drink, because I had this massive thing. Look at it. It's like the size of my head.
I got wine.
I know.
I delivered wine. It was 5 o'clock somewhere.
Oh,
Here.
that's great. Yeah.
When Jeff came to pick up his, he was like, the beer too? So yes, the beer too.
Yay.
Gigantic beer.
It's
Amanda, I thought I should address your question about the abortion fund. I mentioned this briefly in our breakout group, but
okay.
On average, we provide a voucher for each patient of about $150 towards the cost of their procedure. But if anybody is in a situation where they need more than that and they say so, we make it happen. So I think in general, while we are raising more and more money for the abortion fund year after year after year, the more we raise, the more we're able to give away and increase that voucher amount. So, you know, I think the other challenge is just continuing to get the message out about the fact that the Cobalt Abortion Fund exists so that people in need know to come reach out and to ask. Because I think sometimes just asking for help and support is the hardest thing. So that's a big part of it.
I'll give you an example. Sorry to jump in, but New Era Colorado does young voter engagement and turnout, and they had a really robust campaign going on in Boulder a couple of years ago, and they brought 2 young people to testify on one of the many anti-choice bills, and it was called a method ban bill, which was attempting to ban a form of abortion that is typically kind of in the a second trimester procedure. And the 2 young women who came and told their stories, one of them didn't know she was pregnant. So you're in Boulder, right? And there is a university, there are 3 abortion providers in the area. You would assume there were resources on campus. And both of them ran into, the first was a young person who didn't access care until she was in her second trimester because she didn't realize she was pregnant, didn't have access to the resources, didn't know. And the second one actually flew to Chicago to get care wherever she came from because she didn't get enough information. So the idea that anyone is thinking they need to leave the state, they're not getting the information, they don't know what their options are, and they don't know how to access those resources. This is a really critical set of pieces we're trying to close. And the abortion fund is a part of that, right? So for a young person, if they can access, if that's what they want, and we can provide it. And then the other thing to know about the Boulder Abortion Clinic, which is the national hub, it is one of the 5 providers in the country that provide later in pregnancy. Those procedures are quite costly. And so yes, it's $150 for an average kind of a first trimester procedure, but for the more expensive procedures, the costs go way up, and we will fund to need. And so we might spend several $1,000s on one person, plus they're in a hotel, plus they might need pantry or grocery deliveries because it takes a few days for those procedures. They spend time at the clinic, that sort of thing. So I don't know if that helps explain it a little bit, but thank you for saying that, Jamie.
Yeah, so it sounds like the people that come to you, like you're not turning people away, but
Right.
What's happening is that there may be disinformation. And Jamie and Karen, I remember when you were over and we had that conversation, you were telling me about fake clinics that were providing disinformation. What's the status on that? Is that still happening in Colorado? Because I think it'd be interesting for this group to hear.
Thank you for mentioning that. So, and we're even moving the messaging to be clear who they are, anti-abortion counseling centers. And so in Greeley, we actually had a really fun, I'd say it was fun because we won, a fight in exposing a fake clinic or an anti-abortion counseling center in Greeley. So University of Northern Colorado attracts students from primarily in the state. We have 178 school districts, and most of them don't have comprehensive sex ed. So imagine coming from a small community, you're a first-year student in Greeley, and this fake clinic uses the same name as an on-campus women's center. Now they have, the name of the on-campus center has changed, but they basically copycatted them. They use the same graphic and imagery on their logo, and they were telling people they had you could get free STI testing and free pregnancy tests. And so people would come and then they would do this awful counseling. So one of our young interns, she's not an intern now, she's an organizer, but she took it upon herself, built a copycat website, Truth for Greeley instead of Test for Greeley. We collected all of these stories of people who were being blamed and shamed. They went in and pretended they were clients, and they got the real transcript, and then they had people sending us stories. So they actually tried to shut us down, and we beat them. They tried to close down our URL, and we won. And we are trying to replicate that in Boulder because you have a new fake clinic in Boulder. And what they are doing, the reason I'm going to call it an anti-abortion counseling center, is they are now bringing in anti-choice medical people. So they're running a full anti-choice clinic. So you might go in and get all your reproductive health care there from someone who's an avowed anti-choice activist. And it's pretty dangerous. So we're looking at, and we had to stall out a little bit for the campaign, but we're going to brand a new website that's basically Truth for Colorado. We're going to counter them and expose them in the community. And in Boulder in particularly, really think that's important because on the CU campus, these anti-choice centers are, they sign on as an official student organization, and then they get rights to the campus and they get student dollars through the fees. And so we're really trying to block them, and this new tactic has worked. So the impact of even one person going to this place and getting that incorrect information, their whole mission, and they're trained. John Oliver does a great piece on this. If you watch John Oliver, it was from maybe a year ago, February. It's a 20-minute piece, like his normal thing. And you can find it out there, where he had one of the national leaders saying help them, but not too much, because that's not your job. They're not there to provide diapers and car seats, as they say. They're there to keep you from having an abortion. And basically, they're more concerned about no abortion than what happens after the baby is born. So it's a pretty dreadful experience. And there are 3 times as many of those fake clinics as there are actual places to get abortions in Colorado. So they're nefarious and out there. Katie, you've been with us for a while. Is there anything I haven't talked about that you think I should, or any questions that came from the other breakout group?
Well, one thing that I did mention that you could probably highlight more was just that Colorado is a haven, not just for Coloradans, but for the states around us, that we're sort of ringed by places where you can't get an abortion. So maybe you can talk a little bit about that and how we really strive to remain a safe haven.
Absolutely. Thank you for saying that. So you might have seen there's actually some coverage when Texas arbitrarily ended access to abortion care in the middle of COVID. They blamed COVID and said, oh, that's too dangerous to have an abortion, so you can't have one. We had people driving here 15 hours to get care here. So Colorado really strives to stay open for business. And so there's both a network of independent providers and Planned Parenthoods. And we are behind the scenes working to increase access, because especially with RBG and the court perhaps more rapidly going to a conservative bent, we expect Roe v. Wade to be further constrained by 1 or more court decisions soon. And a lot of states have what are called trigger laws, where they've passed a law that if the Supreme Court further restricts abortion, a law immediately goes into effect at the state level. So they've kind of gamed the system ahead of time. So we have states around us that could very quickly either eliminate or further restrict abortion access. And it's a pretty dangerous time, but we are open for business and we will help support even more people here. And we want to also make sure that people know they can get that access. So spreading the word and networking. In fact, we've created a 12-state regional alliance. So if you're in Utah, there's an 18-week ban. You can find out you can come here. If you're in Montana and you can't get access to care, you can come here. So we really try to keep those communication channels open and establish trusted relationships now, so that as the laws continue to get worse, we are a place you can still come.
I'll add too that I stopped at the Boulder Abortion Clinic earlier today to drop off some things for Dr. Hearn. And one of their front desk staff said to me, it's remarkable that such a small fraction of the patients that they see are actually from Colorado. The majority of patients that the Boulder Abortion Clinic sees are from other states and other countries. And she said, I can't believe that Coloradans are the ones who are deciding on this 22-week abortion ban that's potentially going to impact people all over the country and all over the world.
Wow.
Well, and I'll tell you, the Boulder Abortion Clinic behind the scenes has been the reason that Jamie stopped is that, and this is not for public consumption, but they are working tirelessly to help us defeat this ban. Dr. Hearn is writing his personal network and including our envelopes out to everyone. He celebrated the 40th anniversary of Boulder Abortion Clinic, and he had a big party with 300 people. It was like a mini gala. And I said, could you ask those people for help? And he has done that, and they are helping. Somebody put a new roof on his clinic. A woman out of San Francisco sent him $47,000 to re-roof the clinic about 4 years ago. And I remember having lunch with him, and he shared that story. And I said, does your friend with the roof money, do you think she would help? And she gave $10,000 last Friday. So it's really remarkable. You know, and lots of other people, we had someone send a $3 money order, right? I mean, we're everything in between. People are saying, I will give what I can. We also have a conversation coming up next Friday with Sarah Weddington, who was the attorney for the Roe v. Wade case when she was 27. And she and Dr. Hearn are going to be on a webinar next Friday at noon. If anyone's interested, we'd be happy to share the information back to you.
Please do. Do you have like an email or something that we can send our friends in California and Utah and Texas and Montana to, because I think like this group and CHI in particular is focused on local advocacy. So I haven't invited my friends from other states, but I will definitely ask them for money on Cobalt's behalf if you can give me the right wording.
Yes, we can send you something, absolutely, and happy to get that over to you probably first thing Monday, but happy to do that.
Let's include it if we can. Natasha, can we include it in the follow-up email to the whole group?
I already sent it, so.
Oh, you already sent the follow-up. Okay.
We're trying to get our ducks in a row, Amanda.
You're amazing. Okay.
But yes, I'm happy to send something in addition if you feel like that's appropriate.
And or maybe it's a wish list item if it's not already there to send an email to your friends in other states about that.
Great idea.
Okay.
So yeah, I can work.
And
with
what
you
we could do is we could send it to you as a Google link, shared Google, and then you could take it and run with it, and that way it's short in your follow-up.
Perfect. I have a question because as I was hearing you talk about education, and I'm thinking my kids, and maybe Katie at least, like I know that, so my kids are doing Boulder Universal, which is the asynchronous school. But even last year in the spring, they were given access to Brain Pop, and especially the fourth grader, she's like way ahead of her schoolwork. And so she's watching Brain Pop all the time. Like tonight, she's watching Brain Pop on her computer. And it's amazing, actually. I don't know if you've heard about it or you know the topics are actually really interesting. I mean, like fourth graders, first graders are learning about Anne Frank, the Holocaust, Martin Luther King, Jim Crow, like really progressive topics. But I just realized like I haven't really searched to see like what are they learning about. They're learning about drugs. Like what are they learning about sex education and reproductive rights? Just curious, Katie, I'm just curious if you're aware of it or you looked at it.
I'm going to look up Brain Pop, but even consent is one of the things that for younger kids, consent and control over your own body, and who got, that is one of the earlier lessons that help develop that sense of self. But I'll look at that for my 12-year-old who's not, I had to do 2 parent-teacher conferences yesterday. We're not exceeding in online learning. She does well in school normally, and this is not her best self.
It's so hard.
Yeah, I'm definitely familiar with Brain Pop, and I agree. There's some really great content on there. I think one of the things that I found really surprising during this work with Cobalt is the extent of differences among sex ed for students in our school districts, and the limits that are imposed, the disinformation. I know in the St. Vrain Valley School District, they've had a policy where if one side was presented, that another side had to have equal access. And so, people who were coming in to give presentations about reproductive rights were using shame and comparing girls' bodies to toothpaste. And every time you had sex, a little toothpaste got squeezed out, so that if by the time you got married, you'd had too much sex, like you had an empty thing of toothpaste. I mean, this is a sex ed professional brought in by the school district to teach students about reproduction. And it's so awful. Like just being aware of the horrible things that are happening in our school systems, especially around sex education. They're not all bad, but it's something to pay attention to. And I found incredibly disturbing that my kid might experience that. So being on it, you have kids asking, what is the curriculum? Who's coming in to give the presentations? Like just really being aware of that is critical.
Katie, I'd love to, if you have any information on that or links to information on that, I'd love to have that. I'd love to send it to a parents group that we have at work, because I feel like people should know about that at least, that's going on in St. Vrain.
These are a little dated, but we actually exposed it in the Boulder Daily Camera. I want to say it was in early 19, and we spent about 6 months doing it. But the anti-choice groups up there actually admitted in the interview that they were getting in front of 100 classrooms a year. And it sort of level sets that you know, Boulder and St. Vrain have had mixed, at the school level, sometimes things get through or someone gets invited. And if you're not paying attention, you know, they really do a bait and switch the way that they approach. The other thing they will do is provide funding of some sort. You get a grant if you have them come and speak. And so it's really a misleading process. The other thing we've heard is is it Lucky's that has the little coins? If you give, they had one of these anti-choice counseling centers as one of the places to give. And I had a Democratic activist contact me really upset about this. And she was talking to Jonathan Singer about this. And they were all demurring to, oh, but car seats and diapers, it should be okay, because that's the front they present. And then what they're really doing is negative. But that's kind of the thing to be watchful for, is they try to mainstream themselves and make them look like they're just mom and apple pie and you don't need to worry at all. But they have, Longmont has had problems, and they have, the Boulder Valley Women's Health does a lot of the good sex ed, and Planned Parenthood does. And so both of them have been able to counter this in a lot of the places in your area.